everybody know what is urine, and urine is actually the most the most easily available body fluids in our body. Basically, if you want to classify the urine analysis is actually considered as non-invasive analysis. Di mana analisis urine ni dia tidak membawa sebarang uh, bahaya pada tubuh badan. Banding dengan phlebotomy, itu pengambilan darah untuk buat analisis. Urine, sebab setiap hari kita akan hasilkan urine, ginjal kita akan filter 60 kali air di dalam tubuh badan dalam masa sehari. So you can easily take the urine samples from our body. The study of the urine, it all started in far way beyond that to ancient times like Egypt, Babylon, and what else? The more than 2,000 to 3,000 years ago. So these are things that people will tend to look for when they take the urine samples from the patients. They will start to look for the pus cell. So sejenis sel yang didapati di dalam ginjal. So they will start to look for blood and other symptoms of disease. Because when you have existing pus cells and blood cells, that means indicating that some damaging is actually happened in your kidney. Dia membawa maksud sama ada kidney ginjal kamu dalam keadaan yang normal atau tidak, sama ada dia ada cedera ke atau tidak. So urine sample is always become is always a popular specimen to take from human bodies. It is all because of it is a kinds of non-invasive techniques. Dan dia juga jadi popular untuk pengambilan urine disebabkan dia senang untuk didapati, easy to collect, inexpensive tests, and you can find various types of information from the urine. Why you can find the various types of information from urine is about urine tu dia urine tu datang daripada kandungan air yang ada di dalam tubuh badan. Dia melalui keseluruhan badan, daripada jantung, daripada otak, daripada hati sampai ke kamu punya ginjal. Dia akan filter keluar semua komponen yang sudah dibawa daripada berlain-lain jenis organ. Jadi proses filter air daripada tubuh badan yang dimana menjurus kepada penghasilan urine, kamu boleh gunakan komponen yang ada dalam urine untuk tahu keadaan tubuh badan kamu di setiap satu organ. So these are the things that you can know from the urine samples. So you can know the conditions of your pancreas, conditions of your bone, conditions of your liver, conditions of your muscles, and you can even know the metabolisms process that happen in your body, the carbohydrate metabolism, the fats, protein, and nutritions, whether you are in malnutrition or not, electrolyte, respiratory systems, hormone. Do you have any sudden changes of hormone because of thyroid grain, inflammation, or do you have hormone changes because of pregnancy, or do you have hormonal changes because of certain infections, disease? We can know it from the urine samples, and even the inborn error metabolisms, we can know it from the urine sample. That is why urine sample become very popular, and it is always one of the analysis that should be done when you do a medical checkup. We have various types of urine specimens. Generally, it can be divided into three major types. First, morning specimen, random urine specimen, and time collection specimens. The first morning specimen is actually the urine sample that you collect it once you uh, coming up from your overnight sleep or your night sleep. Means approximately it is an 8 hours period of time, or less than that, maybe 6 or 7 hour periods of sleep time that you collected after you wake up. Urine collected only, these types of urine, it will reflect a recumbent positions in your body. So any urine voided during the night collected or pulled with the first morning specimens, it will be voided if you pull the samples. Jadi first specimen adalah urine yang kamu ambil semasa kamu bangun daripada tidur. Kamu tak boleh pull urine tu. Sebelum tidur, kamu ambil urine sample, dan selepas tidur, kamu ambil urine sample, kamu pull dalam satu tube. Itu tak boleh. Itu sudah kiranya tidak boleh disenai dalam kategori first morning specimen. Kadang-kadang kamu akan dapat pesakit yang pemikiran dia agak aneh sikit. Dia mungkin anggapkan untuk buat analisis urine perlukan banyak sampel. Jadi dia akan pullkan sampel tu. Sebelum tidur dia akan ambil urine sampel dan dia pull sekali dengan urine pertama dia masa bangun daripada tidur. Kamu kena berhati-hati. Memang ada pesakit macam ni. Sebab dia orang tak tahu sama ada berapa kuantiti urine sampel yang sepatutnya dia takut kamu marah dia sebab urine sampel kurang. Secondly is the random urine specimen. Maksudnya dekat sini urine specimen diambil tanpa mengira waktu dia, sama sebelah pagi selepas sarapan ke, atau selepas makan tengah hari ke, atau sebelum makan tengah hari. Dia tak kisah masa tu. Specimen, this sort of specimen is actually collected at unspecific times, and it is much more convenient for the patients to take it, and it is suitable for most screening purposes. So you don't have much issue when you urine specimens, but you're going to have issues with this one. First morning specimens and time collection specimens. Time collection specimen most of the times is done on purpose or by purpose, and you give patients with certain medications or certain substances to allow patients to drink it in order to know or in order to determine whether patients is able to perform that particular metabolisms that you wanted to measure. So in general, there are two types of time collections specimen which you can easily find in the clinical diagnostic lab. Itu predetermined length of time 2 to 12 hours or 24 hours. Ini lebih kepada pengukuran albumin dan creatinine. Kalau glucose selalunya 2 jam saja. Ini untuk mengetahui sama ada pancreas patients dapat berfungsi dengan normal atau tidak, atau patient ada diabetic, ada pre-diabetic atau to glucose triggered test. In specific times of that is in the 2 p.m. to 4 p.m. That is purposely taken the samples in order to measure the urobilinogens that available in the urine samples, because by measuring the urobilinogens, you will be able to know whether the patient's liver functions is normal or abnormal. So we have 3 different types of urine specimens. That is the first morning specimens, and then unspecific time taken specimens or specific time urine specimens. Now let's look at the advantages or disadvantages in between these 3 different types of specimens. The first morning specimen, why it is always become the advantageous compared with other 2 types of urine specimens. First of all, it is an ideal specimen to test the substances that require concentrations of certain substances that need to go through the incubation periods. Most of the times is 12 to 24 hours of incubations in order to detect the protein concentrations or nitric concentrations. If patients having more proteins in the body, that means patients might having proteinuria. It is a very good indicators to diagnose whether a patient's kidney is functioning well or not. And also, this one, the first morning specimen, it is also very important to diagnose whether is there any existence of cast cells or white blood cells or red blood cell in the kidney, in the urine sample, sorry. So if you found that a lot of white blood cells and red blood cells are available in the urine sample, that means something is going wrong to the either urinary tract or the kidney of the patients. The most of the time, if white blood cells is found in the urine sample, first morning urine samples, it is all because of the urinary tract infections. So in order to know this one in further details, and you need to perform the cytological studies by using the urine samples. In the cytological study, these are things that we're going to observe it, whether is there any existence of epithelial cells, existence of put cells or cut cells, and the osmolarity of the urine samples, whether it is highly concentrated or the concentrations of the urine samples is in the normal range. Meanwhile, about the disadvantages of this first morning urine samples, you know that the urine samples actually contains lots of ammonia. So when accumulations of ammonia, you're going to form the amorphous urate, which going to form a crystallized salt. This crystallized salt, it will interfere with your cytological studies. Means you can't really study in details about the existence of the epithelial cell, cast cells, and white blood cells. It will interfere with your slight resolutions. And furthermore, the first morning specimens, it is not convenient to collect it. It have to depends on the independence of the patients. It means patients need to be independent uh, to take this first morning specimens. People tends to forget about this one. They go to urine when they wake up from the sleep. So they forget to pick up the specimens. So this first morning specimen, patients require instructions at least 1 day before the appointments. Means a rehearsal is needed, and it needs preservation, if not analyzed within 2 hours of collection. So unlike your unspecific times specimens, you do not need to preserve it, but these things you need to preserve it. This is all because of the crystallization process of the amorphous urate. Jadi ini untuk mengurangkan pembentukan kristal daripada amorphous urate. Kalau letak terlalu lama, sementara first morning specimens dia akan sangat berbau banding dengan unspecific time urines. So random urine specimen and specific time collections, these are the advantages. You can collect anytime, anywhere, any positions. So without prior patients preparations, patients tak perlu sedia dulu apa jenis procedure, and it is good enough to use it for routine screening. But the advantages, it might not be accurate, especially when patients just having their lunch or having their breakfast. Of course, when you're having a lunch and you are having your breakfast, you're going to intake some fruit. So most of the time, you're going to assess the fruit intake. You're going to have excessive fruit intake. And sometimes when patients come for a test, it might have done some exercise or jogging or sports activities. It might affect the urine compositions as well. And another disadvantages of this random urine specimen, if you're doing the qualitative test, it might give you a lot of false positive and false negative result. Time collections, it is the most ideal for various types of quantitative urine analysis. So time collections is the most ideal one for quantitative urine analysis. So for example, the glucose tolerance test, patients are given a glucose to intake and waited for 2 hours before go for the urinary test. Then if you're looking for the albumin and creatinine level in the bloodstreams and in the urine sample, then you need to specify a time for patients to come in. 4 hours to 12 hours of observations. So any types of albumin or creatines or ratio or macro albuminemia, it should be done in this specific time frames, 4 to 12 hours. That means in these 4 to 12 hours, patients are not allowed to do any exercise, and patients are not allowed to intake any extraordinary substances. Remain the normal diet, no exercises, and remain the daily routine activities. Meanwhile, measuring zero periods in order to measure the liver functions. need to wait to be very specific, 2 to 4 p.m. So this is after patients having their lunch. So this advantage about this one, you need accurate timing and strict adherence to specific collection protocols. Means if patients want to go through these tests, for example, the urine test, the glucose tolerance test, patients must require to have a very leisure time or spare time to do it, and you need a preservative to ensure the stability of this component, especially the albumin and creatinines, because albumin and creatinines, they are actually proteins. Protein kalau letak lama di dalam room temperature, dia akan degrade, sama juga dengan urine. So another disadvantages is that most of the time you will find when you get a false positive or false positive or false negative result, it is all because of this medications and foods. Kadang-kadang kamu tahu lah psychology pesakit. Bila dia pergi buat test dekat lab, dia akan rasanya rimas ataupun risau. Jadi dia akan cuba makan sesuatu untuk bagikan keputusan ujian tu cantik lah. Itu pemikiran pesakit yang selalunya ada lah. Jadi dia akan buat test macam ni. Dia akan buat dia akan kontrol pemakanan dia. Terutama bila patients or medications, dia akan tak makan ubat lah. Jadi dia akan efekkan pembacaan analisis tu lah. Besides that, you might encounter some errors during the corrections or handling. So this is under the categories of human errors. If you look at the errors itself, it can be divided into preclinical and clinical errors. So this one is under the categories of preclinical error. Okay, ini salah satu contoh yang specific time collections. Itu oral glucose tolerance. Di mana patients kalau pergi glucose tolerance test ni, dia akan dibagi satu container, urine container macam ni. Ataupun yang bentuk, kamu pernah lihat dekat lab yang bentuk cap warna kuning, urine container yang warna kuning cap tu. Patient akan dibagikan cap tu. Sebelum patients pergi ambil urine sampel, patient akan dibagikan glucose untuk dia minum. Dan selepas dia minum, selepas 2 jam, patients akan dipanggil untuk pergi urine untuk kencing. Sampel kencing tu akan diambil untuk buat glucose level test. Dan pada masa yang sama, darah patient akan diambil juga. Dan sebelum ambil glucose tolerance test, patient tidak dibenarkan mengambil makanan selama 8 ke 12 jam. Jadi sebaiknya glucose tolerance test dilakukan pada awal pagi sebelum patients mengambil sarapan pagi. Jadi itulah susahnya specific time test ni. Tujuannya untuk nak tahu, untuk testnya glucose tolerance test, tujuannya nak tahu sama ada patient ada potensi untuk jadi diabetic patient atau tidak. So diagnostic applications for every urine sample, which is best and ideal for specimens. These are the applications of the specimens that you collected. We have three different kinds of category of urine specimen, and each categories they are meant for certain applications of diagnostic. And for example, the first morning specimens, it is very good for the routine screening, like screening the hormone levels, screening the uh, metabolism levels, screening the electrolyte levels. And it is also very good to study the cytological uh, perspective. That is a cytological studies. And also good for the studies of protein urea, especially the autostatic protein urea. Then your random urine specimens, it is good for routine screening, especially qualitative studies, not quantitative. So good for qualitative, not quantitative, and sometimes you can use this for cytological studies uh, with the conditions patients that go through the hydration process. Then it's good for the fluid depression test. And time collections is good for cytological studies and as well as the quantitative studies. Is using the quantitative assay, but it is not good for the qualitative studies. So the time corrections test, it is also very important for the clearance test, especially the creatine clearance test to test the kidney functions. And time corrections study, it is also important for the variations of fistula. So we have various types of technique for correcting a urine samples. Let's look at the first one, routine voids, which is by using the normal urine container, that is the yellow caps. Then you have the midstream screen catch. That means it is actually a kind of tubing that implanted to the urinary tract. And you have the catheterized uteral, and you have these suprapubic explorations, and as well as the periodic corrections back. So these are the routine voids uh, container, or you use it for these three major types of specimens: unspecific urine time, or specific times of urine, or first morning specimens. So simple, and you do not need prior preparations for patients. What patients need to do directly urine to the container, and it do not require any assistance. So midstream clean catch, this one, most of the time it is used for the procedure purpose, especially uh, you're trying to pick up the sample from the vagina or from the semen samples. The patient need to produce the semen samples for the analysis purpose. So that means this one clean catch, midstream clean catch cap. You need to be cleaning supplies, and you need the assistance from somebody in order to get the vagina fluid, or in order to get other types of body fluids. So catheterized uterine, this is actually involve minor procedures, minor surgical procedures, which require the attendance of the medical personnel. Jadi dia sebenarnya adalah minor procedures yang perlu dilakukan oleh pegawai perubatan. So what these specimens where this specimen will collected from, it will specimen ini dia akan diambil daripada bladder, di mana ini benda ni dia akan masukkan ke dalam kamu punya UTI, urinary tract. Ini adalah kalau untuk lelaki dia akan masuk ke sini, kalau untuk perempuan yang masuk ke sini sampai masuk ke dalam bladder kamu, dan dia akan pipe up keluar kamu punya urine samples, ataupun biarkan dia mengalir ke dalam plastic bag reservoir. Jadi ini biasanya akan digunakan, sampel jenis macam ni dia akan digunakan untuk urinary tract infections, terutamanya untuk STD. Suprapubic aspirations ini adalah untuk pengeluaran amniotic fluid, selalunya digunakan dalam bentuk macam ni, di mana needle akan dimasukkan ke dalam kamu punya bladder kamu, urine akan dikeluarkan. Jadi ini jenis metod ni tak biasa dilakukan sebab dia jenis invasif. Biasanya digunakan untuk pengeluaran amniotic fluid. Tapi sekarang tidak digalakkan buat sedemikian sebab dia akan menyebabkan infections berlaku, terutamanya infections bila masuk ke dalam tubuh badan. So sometimes this is performed due to the suspicious of bacteria infections, especially those anaerobic bacteria. STD itu adalah sexual transmission disease, bukan STD, STD, T Terengganu. Ini pediatric collections pack, ini untuk budak kecil, biasanya dilakukan untuk budak ataupun bayi yang baru dilahirkan, newborn patients. Di dekat sini sebab patients tu dia tak boleh bertutur, dia tak boleh bercakap, dia nak urine. Bila dia nak urine, dia pakai hantam saja. Bila saja dia nak urine, dia akan urine. Jadi bag ini digunakan untuk mengambil urine sampel dia. Jadi dia akan pakai dekat badan pesakit tu. Dia akan collectkan bag ni, dia akan collectkan urine sampel pesakit. So you have to check it every 15 minutes of the samples of the bag that hanging on the patient's body. So until you get the requirement or specific amounts of volumes that is good enough for you to do the analysis. In order to do this analysis, you need a full attention to the patients, because when you get enough quantity of specimens that allow you to do the analysis, immediately you need to transfer the samples to the lab in order to avoid contaminations. So you have various techniques for correcting the urine specimen. You have the routine void, midstream categorized literal, suprapubic aspirations, and periodic corrections background. Each of these, it is good for the analysis of urine samples, and it have to depends on the types of analysis that you wanted to do on the patient's body, on the patient samples. The most Common one is the routine void techniques. That's why it has been commonly used for normal clinic. But if you go for specialist clinic, they will use a mixed sprinkling catch, catalyzed uteral, suprapubic aspirations, and pediatric corrections back. Oh. No, in when you're working in a lab, we get collect the samples. This is for the perspective of cost effectiveness. Sebab kamu nak kurangkan pembaziran, kamu nak kawal cost tu. Bukan kamu terima saja sampel, kamu nak terus buat analisis. Kamu sebenarnya ada waiting period untuk tunggu sampai sampel yang memadai ataupun yang sudah cukup untuk melakukan analisis. Ya, kamu masih boleh melakukan analisis walaupun kamu adanya satu sampel, tapi dia tidak cost efektif. Jadi memang sebenarnya kalau dekat mana-mana satu lab, sama ada lab swasta atau government lab, dia akan tunggu dan collect sampel dulu, barulah lakukan analisis. Urine samples, the best way to perform the analysis once you receive the samples, immediately within 2 to 4 hours, you need to do the analysis. And most of the times, when you look at if you look at the forms itself, when it is required to do the UTI test, urinary tract infections disease test, that one you need to do it immediately, to do the extract, to do the culture, to do the microscopic observations, because it will affect the bacteria test results. Kamu tahu lah yang kamu belajar tadi yang ammonia tu dia akan bentuk crystals. Kalau kamu dibiarkan lebih lama, dia akan bentuk lebih banyak crystals. Dia akan menyebabkan pematian kamu menjadi lain pula. So if the types of specimens that you need to go through the routine screening, it is not involved with tests of bacteria, normal screenings. You can actually put it into the refrigerator, wait until other samples arrive, and only then you run it at the same time. These are the tests that under the categories that you can put it